Как человек может узнать, что у него рак предстательной железы? Каковы его симптомы?
Well, that's a very good question, also very important to know for the patients. There are no symptoms. As long as the cancer is curable, there are no symptoms. It's a life-threatening disease, so you can die of it. And so this is a very important thing to know for the patient. Every cancer can kill the patient, and so you should find it early to make it a curable case.
Какие преимущества для пациентов из России, которые едут на простатэктомию да Винчи в Гронау?
So the medical part was discussed before, but we have Russian-speaking physicians and other staff members, and also service around for Russian patients, so that the patient and accompanying relatives feel comfortable.
В чем отличие клиники Гронау от других клиник?
Well, there are several points. First, we have the largest robotic program in Europe. We are doing the most radical prostatectomies in the world. Second, we have a dedicated team, so robotic surgery is also a team approach, and so we have specialized team members for every step of the procedure. That's very important. Third, we have a very strong quality management, looking at our data. And fourth, we have also a good service for the patients all around.
Что отличает операцию да Винчи от таких методов, как, например, брахитерапия, лапароскопия или открытая операция?
Well, also a good question. I think you cannot compare robotic surgery with brachytherapy or external beam radiation therapy. That's another possibility for treating prostate cancer. But you can compare this to open surgery or laparoscopic surgery, as discussed before. The movements are more precise. You can do a very exact preparation of all the structures around the prostate or other organs which can be operated with the robot. And so you may have better oncological and also functional results. And this is very important for the patient to have good results.
Как именно делается простатэктомия да Винчи и каковы ее преимущества?
Yeah, robotic surgery is a telemanipulation system. So the surgeon is working from a console, and the instruments are manipulated by the surgeon. He is sitting several meters away from the patient, and he has the advantages of open surgery because he has a 3D vision, which is very important for precise movements. But he has also the possibility to move the instruments like wrists, like a hand wrist, which is not possible in the standard laparoscopic approach. So in the end, you combine the advantages of open surgery and minimal invasive surgery, like less blood loss, less pain, and faster recovery.
Связаны ли с простатэктомией да Винчи какие-то определенные риски для пациента?
No, not really. So any patient who is able to receive an open surgery can also get under a robotic procedure. That's possible.
Как долго длится восстановительный процесс после операции да Винчи?
Well, very good question too. There's no one recovery, I think. The patient should move around the next day, so he get out of the bed on the first day of the procedure, and the next day he's doing almost everything by himself, so he should be mobilized for 4 or 6 hours the next day. And to get back to normal activity like walking and jogging and so on, you need some days. To get back to full recovery, maybe it's for 4 to 6 weeks.
Сколько урологических операций методом да Винчи вы произвели на сегодняшний день?
Yeah, okay, this is also a very important point, I think. We are not only doing radical prostatectomies, we are also doing renal surgery or pelvis surgery for the renal pelvis, or bladder surgery or reconstructive surgery in urology. Overall, we have done more than 3,200 robotic surgeries right now. About almost 3,000 robotic prostatectomies, and me by myself about 2,000 robotic prostatectomies.
Как выглядит кривая обучаемости для хирурга, который работает с системой да Винчи?
So there are different learning curves for sure. An experienced surgeon, so in the end, never stop learning, that's for sure. So you're an experienced surgeon, in my eyes, if you have done more than 500 or 1,000 robotic procedures. And so there are many centers who have robots, but the surgeons are not so experienced, the team is not so experienced, and so maybe the results are not comparable with very high volume centers.
У вас длинные листы ожидания на простатектомию да Винчи?
We have a waiting list of about 4 to 6 weeks, but you also have to know that after biopsy you should wait 6 to 8 weeks prior to the surgery. So usually it's not a problem. If there is any reason to go for an earlier appointment, that will be also possible.
Может ли пациент в вашей клинике получить второе мнение, чтобы с точностью определить, есть ли у него рак предстательной железы?
Yes, sure. So slides can be reviewed from other centers where the biopsy has been done, or the patient can come for a second opinion, like to discuss his possibilities, or get a biopsy or another diagnosis for prostate cancer, no problem.